All right, here we go. We're going to talk about Donald Parham, tight end for the Chargers.
Protected. End zone caught. And now the ball comes out incomplete. The tight end, Donald Parham. And he's hurt.
I think you guys, if you're watching this, you saw that injury that happened playing the Chiefs the other day. It's kind of scary looking. So as you can see, catches the ball, lands on his butt back, and his head whisks back, hits the ground. So he has an impact to his brain. So as he's being taken off the field in the cart, you can see him kind of doing something that looks really frightening. His arms are kind of like this, and he's shaking a bit. He's got a traumatic brain injury. Okay, so you can call it a concussion, which I think is a nice term that doesn't sound as scary. It's a traumatic brain injury. These are what concussions are. Concussion doesn't mean you have to lose consciousness, although that is one of the things that can happen. And no matter what, if you have a concussion, you're going to have some long-term effects, especially if you have more than one. Okay, there's studies that show that 20% of people who have a concussion are going to have long-term effects. Some studies that say it might be closer to 50%. You guys have heard about the movie. You know about CTE. Probably read recently about a former NFL player who committed some terrible, terrible things and then took his own life. These are things that can happen after your brain has been injured, especially the frontal lobe, which is the center for inhibition. Right? People have personality changes. People have dementia. Anyway, so Donald Parham. So let's look at what happened. So he lands on his butt, his back, and then his head hits the ground. His head accelerates, as you can imagine. Think about it. Watch that film. The injuries that happen to the brain happen because of acceleration and deceleration. So the brain is just this kind of mushy, kind of, not really like jello, but kind of a mushy, soft organ, surrounded by this fluid, connected to the skull by all these little tethers. And it has really fine blood vessels that attach to it, and it has blood supply within it and without it, right? So think about this. Imagine you had a bowling ball, and you tied, some fishing line to the bowling ball. I'm not talking about 100-pound test or whatever the heck you call it. Oh, let's not call it fishing line. Let's say you tied some silk thread to it, right? And then you took that bowling ball and you dropped it, or you rolled it across this table, and as it's going that way, you pull back on it. Acceleration, deceleration. What's going to happen to that string? It's going to tear, right? So when the brain, when you have a blow to the head, okay, the brain inside your skull accelerates and decelerates. It can tear some of those blood vessels, some of those tethers to the skull. It can also hit the side of the skull itself with the first hit, and then it can bounce and hit the other side, right? That's a coup, contra coup. Coup is the first hit, contra coup is when it hits the other side of the skull, right? Certain parts of the skull that are worse to hit than others. If you notice, when boxers or MMA fighters also keep the chins tucked. I don't think MMA fighters don't do that as much, but boxers keep their chins tucked. Why? Because if you hit somebody up here, okay, you get forces distributed. There's not as much acceleration, deceleration. So a lot more bone here. You want to get hit on top of the head. You don't usually see people knocked out there. You do see people knocked out when they hit the jaw, when they hit the temple, certainly in the back of the head, right? And that's because you have first the force, second you have the rotation, which is really bad for the brain because that really can tear some blood vessels, tear some of the tethers. So that's where you see people get knocked out. Jaw, temple, back of the head, which you're not supposed to hit the back of the head. That's against the rules in boxing, against the rules in MMA. It's a dangerous spot. Not much protection right there. There's actually a hole right there. Anyway, so what has happened to this player is he has a traumatic brain injury. What happens when you have an injury is you have some cells die right away, right? That makes sense. If you just squish if you squish some cells, you're going to lyse them. In other words, they're going to break. Potassium's going to leak out. Calcium's going to flow in. Okay, everything is governed by the flow of charges in the brain. That's the way to think about it, right? So when that calcium, the calcium flows in after the potassium has dropped off, you've changed, remember, 10 times, you've changed the ability of the brain to function normally at that moment. You're having a bunch of neurons fire at the same time because you've disrupted the brain. So when you see people posturing like that, there's a response that's in newborns called the asymmetrical tonic neck response, where newborns will kind of extend and look over to the flex, I think, and extend, right? Look over to the flexed arm. But that disappears with time. When people get hit like this, and they suffer this traumatic brain injury, their response is that same response. It's called a fencing response, but it's kind of related to that primitive response that you see in newborns that goes away. And you'll see the person with extended arms or flexed. And you've seen this, right? You've seen this in people who get knocked out in boxing or MMA. You've seen some of them spasming, okay? And you've certainly seen it in football. And that's what's happening with this player. He had traumatic brain injury. He had this massive electrolyte imbalance in his brain because some cells were dying. Disruption in blood flow to the brain. That's what causes you to pass out, right? Because you have a disruption of blood flow to the brain. And sometimes it happens not right away. You don't see the person pass out right away. There was a boxing match or an MMA match that I think we talked about at one point, where the guy was hit and it took a few seconds before the person, actually lost consciousness. There's a disruption in blood flow. The brain shuts down, and then what your heart has to do is pump enough blood to the brain for it to allow it to repair itself. That's why it can take varying degrees of time for people to come to their senses or wake up after they've been knocked out or they lose consciousness. And in some cases, a person can have a concussion, can lose consciousness, wake up, and it seems like there's nothing wrong with them. So a concussion is the loss of the ability for the brain to function normally, which can include a loss of consciousness, but doesn't have to, right? So, person gets a concussion, traumatic brain injury, decrease in blood flow. They have an alteration in their brain function, and then hopefully they recover. You don't want that thing to happen over and over again, because each hit is worse and worse. This is why they have doctors at the ringside at boxing matches, right? Because they're looking for signs of traumatic brain injury, and when they need to stop that fight, because if it keeps happening, the boxer is probably going to die or be really, really seriously damaged, right? One of the things that you see when a person gets hit hard enough is their legs get shaky, and that's because their normal brain function's been altered. They can't coordinate their legs. They can't move back and forth as quickly. They get flat-footed. That's one of the signs that the doctor's looking for, right? So if he sees that, and it looked like the officials also looking for this as well, right? So that's why they'll call the fight, because they realize at that point, if this person gets hit one more time, they're out, and there's no need to put them through that additional punishment because they're already on the way there. So the official will see it. The ringside doctor certainly can see it, and that's why they have the doctors over in boxing. They don't want that person to be injured beyond belief, but it still happens, right? And even after people get knocked out, they recover and so forth, there's long-lasting effects to that. Unfortunately, the sports we watch cause damage. So while we're talking about this, let's talk about some of the protective things that have been done in some of the sports, or what we think of as protective, right? So, back in the days, boxing was bare-knuckle boxing. These guys used to fight like this, right? Here's the thing. When you're a bare-knuckle boxer, those matches could last 30 rounds, right? And part of the reason is because those boxers wouldn't necessarily use all their force when they tried to hit somebody in the head, right? Because they could risk breaking their hand. So they'd punch other places where it's not as likely to break their hands. but also those places are not as likely to have the person have a traumatic brain injury because you hit them in the head and knock them out, right? So they developed boxing gloves saying that, oh, this will protect people. But it may have actually done the opposite, because what happens is now that the boxer doesn't feel as much pain with the punches. So you can throw more punches at the head. Boxing styles changed. People started going for more headshots, right? So in essence, people were hitting harder and they were hitting in the head. Is that protective? Because remember, the issue with traumatic brain the issue with force to the skull is the acceleration and deceleration, right? You've heard this when boxers talk about precision and speed beats strength, right? Because acceleration, deceleration. Yes, obviously a big blow to the head is a big blow to the head. But if the boxing glove allows people to punch harder, faster, you're transmitting more force to their brain, more rapid acceleration, deceleration, more traumatic brain injuries, okay? Football. We have football helmets, right? So the football helmet, theoretically, is supposed to distribute the force, which it probably does. But remember again, acceleration, deceleration. If you get hit, if you're wearing a helmet, if you still have the same acceleration and deceleration, that brain is still going to experience is going to sustain damage, right? So football helmets they do prevent skull fractures. They're good at that, right? But they don't stop that rapid acceleration and deceleration, which is causing the traumatic brain injuries. They may decrease the amount of rotation that happens when a hit happens, which again, remember, rotation is not good. But I don't know, they don't really change the amount of force that's applied that then causes that brain to accelerate and decelerate rapidly and causes the damage. So some of the safety things we have may not be working as well as we think they're working. So we don't know how bad this concussion is. It's bad enough that he, I think, lost consciousness. It's bad enough that he's having this fencing response afterwards. He's going to go through the concussion protocol, and he'll likely come back and play football. But there are more and more players who are saying, you know what, I'm done. I don't want to deal with this anymore. But when that's your bread and butter and your means of earning a living and feeding your family, you got to eat.